Hello, class. My name is Michael Hall, and for my presentation today, it's titled Physician's Assistant as a Career Choice. This is my choice for what I want to be, so let's get started. I wanted to start this slide, but before I start the presentation, I wanted to use the first slide for this important quote that I always kept to myself, and it encouraged me to do what I want to do and continue to do so. So it goes like this. I can accept failure, but I cannot accept not trying. And this quote is from Michael Jordan. And the reason why this quote is really important to me, because I know getting a degree, going to school requires a lot of obstacles. And if you don't try it, you'll never know. And then just having that idea, not trying, is going to be bothering you. You don't want to look back and tell yourself like, what if I did this? What if I didn't do, what if I could have made it? Who knows? So I wanted to start this quote before I started my presentation. Okay, so what I learned about physician's assistant's profession in this course. So throughout the course, this is the first profession I looked in the book. So I had jotted some notes that why I chose this profession, why I was interested in this profession. So physician's assistants are in high demand because of practicality and cost, which means physician's assistant almost has the same power as a doctor. Not entirely, you're still supervised by a doctor, but they can prescribe medication, they can assist in surgery, they can do things that that maybe other clinics or hospitals would hire PAs over doctors because of costs. Another reason too is physician's assistant has a range of scope of practice and can switch specialties. So they can, one day specialize, like, I don't know, in cardiology for years and just then get bored and decide to do dermatology. So that's what's great about this profession. And physician's assistant does not require years and years of schooling like a regular physician. So doctors have to go through medical school, which is 4 years, and then they have to go for another 4 to 6 years for residency. So you don't have to worry about that if you're trying to become a physician's assistant. So American Hospital Association moments. So what is the role when it comes to physician's assistant in the American Hospital Association? This is what I jotted down. Physicians do not have to be physically present for PAs, but has to be nearby or telephone, which means a physician can be in another building, but within like maybe a few mile radius, and still practice as long as the supervised physician is, are communicating with the physician's assistant. In hospitals, PAs can be on call for different departments, but are required to have the training necessary. So if a PA is in a hospital, a PA that works in a hospital does, like, let's say he or she works in surgery, right? He or she can also, in that same hospital, work in another area if they're needed. Like, for example, like at a X-ray technique, like a radiologist department, but they have to be trained to do that. So most insurance companies link patients to physician's assistants directly rather than the physicians themselves. So when a patient comes to the hospital, like for like minor to moderate injury, so usually they don't really go directly to the doctor. They can just go to the physician's assistant, and he can just diagnose and then write prescription. So, and physician's assistants have some degree of similar practices, just like a regular doctor, such as delivering babies and suturing wounds. Yeah, like just kind of like from the previous point I mentioned earlier. So yeah, physician's assistant can actually deliver babies without the physician being there, like supervising. So that's really cool. And also they can actually, after the doctors finish, maybe like, let's say the doctor's removing a benign tumor, the physician can just leave, and the physician's assistant just takes over and just suture up the wound. So that's one of the roles that when it comes to American Hospital Association and physician's assistant, that's what these points infer. Okay, so this is what my value that's kind of connected to why I want to become a physician's assistant. So morality, knowing what's wrong, what's right. I know when something doesn't look right, I take the initiative and just correct it. And I make sure that even nobody's around, I just know in my head that I did the right thing. Same thing with work ethic. So I work really hard knowing that, because I work hard good things will happen to me. Good things will come. People will see that. People will refer me. So that's why my work ethic is pretty strong. And integrity, I do it because of integrity. I want to get respected. I want people to look at me and think like, okay, this guy's actually a legit kind of, legit worker. He's not lazy. I've been working with him for years. So, and in responsibility too. Any job I have, as if I were to work as a physician assistant, I make sure I am obligated to complete it, and that if anything was wrong, I would let people know. I would let my supervisors, my coworkers and colleagues know about it. Prudency, just knowing like what a normal person would know. Like if I was working with patients, I know that patient would expect something from me, like that I would know what they know that makes them feel comfortable. And open mindfulness. I'm gonna be, I deal with a lot of people, regardless of you working as a physician's assistant or not. I'm gonna have to know how to approach people and make sure like I don't judge people. I'm like non-biased. I'm very impartial. So these are the values that ingrained in myself to become wanting that would make me perfect to become a physician's assistant. Okay, so here's the pros and cons. So the pros about being a physician's assistant, obviously the high salary, because they're really in demand. Professional status, respected occupation, easy to find a job, flexible schedule, and helping and giving back to the community. The cons, however, though, just becoming the process of becoming a PA is just really tough. So it's a tough program to get into. It's very competitive. You must have a high GPA and a great academic background, which means they want to look at where you worked before, what kind of experience you have you joined any clubs, have you shadowed any PAs before, stuff like that. And other cons would be like high tuition. It's not cheap. Like I think the average price for a PA program in California that is between 100 to 150,000. So yeah, it's a lot. And then the prerequisite courses are difficult. Most of them are science classes, chemistry, physics, biology, calculus, anatomy. Yeah, those classes aren't easy. So you have to study a lot. And then that's what are the cons about becoming a PA. The next steps to the PA path. So this is my personal next step. Like this is where I am right now. And this is my progress. So starts out with right now, my first priority is to score a highest grade as possible and join a physician's assistant club in the Cal State Fullerton, which is PACT. It's called PACT, stands for Physician's Assistant Coming Together. And then graduate with a bachelor's degree in public health with the general studies concentration. Continue working with patients as a surgical technician. That's my current job right now. I still need the hours and then to update hours when I submit my application, let them know that I haven't forgotten, my healthcare experience, and it hasn't been too long. It's still up to date. Save money for tuition program. Like I said, I'm working as a surgical tech. I make fair enough amount of money. I do have like a portion of my paycheck that is designated for this program, so I can afford. Prepare for application with academic and professional profile. Like do some practicing about interviews, open interviews, in case they do accept me, and I'd have to know what to say. Just keep practicing mock interviews and stuff like that, and keep trying and be positive. Even if I don't get into these programs, there's always next year, next semester. So just keep trying and trying. Okay, so this slide, I'm gonna just pretty much tell you what the physician assistant occupation is all about, so you can get an idea. So let's start off with values. PAs hold their primary responsibility to health, safety, and welfare and dignity for all human beings. PAs uphold the tenets of patient anatomy, beneficence, non-malfeasance, and justice. PAs recognize and promote the value of diversity. Responsibilities. Physician's assistants work on teams with physicians or surgeons and other healthcare workers. Their specific duties and the extent to what they must be supervised by physicians or surgeons differ from state to state. Physician's assistants work in all areas of medicine, including primary care, family medicine, and emergency medicine, surgery, and psychiatry. The work of a physician's assistant depends in large part of their specialty or the type of medical practice where they work. Day-to-day duties. Making rounds by performing patient exams, diagnosing illnesses, assisting in surgery, ordering and interpreting laboratory tests and x-rays, prescribing medication, developing and managing treatment plans, advising patients on preventative care and optimal health practices. Skills. Understanding of complex patient presentations investigate an analytical mind, foundation knowledge, practice-based learning, system-based learning, critical thinking, professionalism, interpersonal communication, stress management, detail-oriented, compassionate, independent, and collaborative, and adaptable. Education and training. PAs is a 2 years master's program. The exam is given by the Physician's Assistant National Certifying Examination, also known as PANCE, administered by the National Commission on Certification of Physician Assistants. Courses required are biology, English, chemistry, mathematics, psychology, social science, pathology, anatomy, physiology, microbiology, clinical pharmacology, clinical medicine, geriatrics, disease prevention, and medical ethics. Job considerations. Employment is expected to grow 30% from 2014 to 2024. Because of the contained cost of healthcare establishments, their schedules vary and is physically demanding job of outstanding and walking most of the time. It can be in an office or in an operating room. So that concludes my presentation, and here are my references, and thank you for taking your time and listening. Thank you.